Sexualize an anti-cancer vaccine and consequently deny females an additional form of preventative health care that has the potential to save millions of lives. Taking away the fear of cervical cancer is not going to affect anyone's sexual behavior.
The Gardasil vaccine can be thought of as similar to any other preventative vaccination. For example, just because you receive a tetanus shot does not mean you are going to go step on a rusty nail.
Likewise, just because you receive the Gardasil vaccine does not mean you are going to engage in unprotected sex.
We decided to investigate whether UVic students know how much Gardasil costs.
It's really expensive though. It's like $500 for the first shot and like $200 for the second shot.
It might have been around $130 per vaccine.
Yeah.
And there were 3.
I think it's around $150 each for each injection.
I think when it comes to your health that if you can afford it, then it's a good investment.
So it's like $175 now per injection. So there's 3 of those. So it's pretty expensive.
How does that make you feel?
It's kind of lame because it's important.
As you can see, many UVic students are either unaware of the cost of Gardasil or just know that it's going to cost a ton. In BC, each vaccine costs approximately $120, depending on where it is administered. 3 doses are required over a 6-month period, bringing the total cost to approximately $360. Considering that university students have little to no income and that our age group is at the highest risk for contracting HPV, we think it is unrealistic and unethical to charge $360. We decided to investigate health insurance coverage for Gardasil among university-age students.
Did your extended healthcare plan cover any of the amount?
I don't think it did.
I was told by one of the pharmacies out here to do it because I'm a grad student. UVic decided the undergraduate program anyway with Green Shield now covers most of Gardasil. As a grad student, it doesn't.
Did you have to pay for the vaccine yourself, or did a parent pay for it, or was it covered by your healthcare coverage plan?
I paid for it myself. It would be nice if it was covered by the government.
We asked Jennifer Gibson from Island Sexual Health Society if there is a program available for young women to be vaccinated at a reduced cost. Her response was,
At this point, Island Sexual Health does not have a subsidy program in place for Gardasil. However, Island Sexual Health attempts to make the vaccine as accessible as we can by selling it to clients at a reduced price, the cheapest in Victoria, $138 per injection.
In contrast to Canada, Australia has a vaccination program in place for young women our age.
Over the 2 years of the program, all students from the age of 12 to 17 would be vaccinated within their school. So the schools would have to send a consent form home to the parents, and the parents would have to give consent. And this is just for daughters, though, not for females, not for boys. And then, if the parents consented, then the children would be immunised first time, and then after 2 months the second time, and then after 6 months from the initial vaccination for the 3rd time. And that's within the school, and it varies because there's different states and territories. It varies like in exactly the time frame and when they did it. But over those 2 years, there's supposed to be it's like a catch-up round, and then after that catch-up kind of finishes, for 12 and 13-year-old girls, it's just going to become part of the regular vaccination program within schools. So like they get measles, mumps, rubella, whatever else they're immunised against, just got to become regular for 12 and 13-year-old schoolgirls. Up to the age of 27, over this 2-year period, females that aren't at school age or aren't at school can go to their GP or immunisation centre and get the vaccination for free as well. Even if it wasn't exactly the same, I think some sort of program, obviously optional, like if you don't want the vaccination, you don't have to get it, would probably be successful.
What motivates young women to get vaccinated?
My family doctor suggested that it would be a good thing to do.
My mum thought it was a good idea for us to get it.
And I was actually one of the last people in my group of friends to get vaccinated because I just didn't really think about it. I was just like, oh yeah. I had other things on my mind, and all of them were like, Grace, you should hurry up and get it.
I think anything that you can do to protect your health is a good thing.
Are young men aware of HPV?
Do you think most guys are aware of HPV and the fact that there's a vaccine out there?
I would say the vast majority of them, no, probably not.
Yeah.
Yeah,
Do you think that more guys should be aware of it?
absolutely.
Should young men be vaccinated?
Well, I don't see why it wouldn't be targeted towards men as well.
Like a lot of doctors, like within their little circle, a lot of them think that boys should be vaccinated.
Like, I've gotten a prescription for it, I haven't filled it yet.
So do you plan on filling your prescription soon and getting vaccinated?
Yeah, totally.
Although women get 95% of the disease that HPV causes, the virus does not just affect women. Men can develop external genital warts, precancer, or cancer of the penis and anus, in addition to cancers or warts in the mouth or respiratory and digestive tracts. Bradley Monk, Associate Professor in Gynecologic Oncology at the University of California, argues that Gardasil should be given to both men and women. Monk says,
We need to move toward a paradigm where this is a universal vaccine. To have a vaccine that prevents cancer and not use it would be one of the greatest tragedies. Vaccinated boys and men would be protected from genital warts, and since men can transmit the virus to their sexual partners, all women and men should receive this vaccine.
Many doctors who hold the same view have already vaccinated their sons against HPV.
Is there a social stigma surrounding HPV and Gardasil?
Do you think there's a social stigma around HPV, around speaking about it or talking to healthcare providers or your friends?
Well, I think there is some kind of stigma attached to any sexually transmitted infection, but it's important for people to talk about it and to inform themselves about it and to talk to their friends and family. And
I think the more people who get it, the less of a stigma there might be. Because I remember at first there was the whole thing like so-and-so had this, fainted because they got the vaccination, and there were a few cases like side effects and everyone scaring each other at first. But I think once more and more people got it, they realised that the benefits and the number of people who weren't being affected by side effects are all kind of outweighed the few that had it.
Is there a lack of awareness? We also asked Jennifer Gibson why Island Sexual Health believes more young women aren't being vaccinated.
I can tell you that many of the young women I speak to about HPV are not aware of the physical and emotional risks that accompany the virus, so this could be a contributing factor. I think the cost is also a barrier for many young women.
I guess I would have to say I'd want to know a bit more about it and, what are the risks of getting it, without it, and, what happens. Like, what does it protect you against, and what exactly happens when you contract it? Just basic stuff like that, I think, and then maybe I'd be more inclined to do it. Otherwise, I haven't really heard a lot about it, so I think maybe the motivation to get it when I don't know, what happens and how it affects you, it doesn't really get me motivated to protect myself in that way if I don't really know, what happens. And I guess I guess in my case, I feel like no one's ever really talked to me about it before. It doesn't seem like it's something you hear about a lot.
An HPV vaccine is relevant to university populations because the vaccine also works for sexually active women. The vaccine is likely to be as effective for 40-year-olds as it is for teens. As Diane Harper states,
the vaccine is the most significant advance in cancer prevention and women's health in 50 years.
Unfortunately, even though young women our age would benefit from the vaccine, we can't receive it for free or even at reduced cost. Therefore, the majority of women in our age group, 15 to 25 years old, have not been vaccinated.
We believe that all women our age should take control of their sexual health and seek information about HPV. We also feel very strongly that we should have the option to be vaccinated independent of our economic status.
We hope that our film has increased the awareness concerning HPV among university-age students.
Concerning the vaccine, we would like to see a decrease in the cost, for Canada to implement a national immunization program similar to that seen in Australia, as well as education and vaccination campaigns aimed towards young men.
For further information, please check out these online resources.